Thank you to everyone for joining us today. We're here at the Caregiving Across Communities panel webinar. We have all our lovely panelists on screen today. We're going to start with brief introductory remarks from Nicole Becerra from ACL. So Nicole, please take it away. And thank you for being here.
You, Dana. Hello, everyone. I'm Nicole Becerra, and I'm an Aging Services Program Specialist here with the Administration for Community Living. We appreciate you all joining today for the collaborative webinar on caregiving across communities in honor of the Older Americans Month. May is Older Americans Month, and this is led each year by the Administration for Community Living. It's a time to recognize older adults, their contributions, and highlight aging trends and reaffirm our commitment to serving older people in every community. The 2026 theme this year was Champion Your Health. It emphasizes prevention, wellness, and personal responsibility as the foundation of healthy aging. It encourages older adults to take an active role in managing their health, advocating for themselves, accessing preventative care, and making informed decisions that support their independence. Demographic trends continue to reshape our communities. In 2020, adults aged 60 and older outnumbered children aged 5 and under. Between 2015 and 2050, the proportion of the global population over 60 will nearly double from 12% to 22%, according to the World Health Organization. With a growing older population comes growing needs from both formal and informal caregiving. Caregiving is a demanding necessity that affects every community and every demographic group. Approximately 59 million Americans may be providing unpaid care, with nearly 1 in 4 U.S. adults serving as a family caregiver. That's a 45% increase just from 2015. We know that family caregivers provide unpaid care to family or non-family members age 65 and older in our older adult population. As people age, many experience more complex health needs, which can increase the demands placed on caregiving. According to the 2023 Profile of Older Americans, an ACL publication, most older adults have at least one chronic condition and also have multiple or could have multiple. Some leading chronic conditions among older adults 65 and older include arthritis, COPD, emphysema, chronic bronchitis, diabetes, hypertension, cholesterol, to name a few. Caregiving fits naturally and powerfully into the Older Americans Month theme, Champion Your Health. Caregivers are essential partners in supporting the health, independence, and dignity of older adults. We invite you all to visit acl.gov/OAM for information about the 2026 theme, along with the materials and ideas that you could use in your local community. Today, you all have the pleasure of hearing from all 5 ACL-funded National Aging Minority Technical Assistance Resource Centers on caregiving across the community. The resource centers are designed and help disseminate culturally and linguistically appropriate health promotions and disease prevention information, and they provide targeted technical assistance and training to our aging network across the United States and territories, as well as for older adults and their caregivers. ACL-funded resources are a vital part of the aging network. They help to expand awareness, services, and access for all communities. And at the center, we have our coordinating center to support and uplift these themes and trends across this group. I will now turn it back over to Dana with NYAM to get us started. Thank you so much.
Thank you so much, Nicole. We are the coordinating center that Nicole mentioned at the New York Academy of Medicine. My name is Dana Javadi. I'm the director of the Center for Healthy Aging at NYAM, and we have also on the panel call that you can see on your screen, Yushao and Isaac, who are also members of the team. Now I will pass it on to the Technical Assistance Resource Center's panelists who very kindly have joined us today. Why don't we start with NCBA? Angie, do you want to introduce yourself and pass it on?
Sure. Thank you, Dana. I'm Angie Body, Director of Health Programs with NCBA here in Washington, D.C., and I'll pass it to Billy.
Thank you, Angie, and everybody here. I'm just pleased to be here with this opportunity and these expert panelists that I just appreciate each and every one of you. My name is Billy Tohi. I'm the Executive Director of the National Indian Council on Aging. We are headquartered in Albuquerque, New Mexico. I am a tribal member of the Oto Missouri tribe of Oklahoma. And so I'm just very pleased to have this opportunity, and I will pass it on to Christine.
Thank you, Billy, and hello, everyone. My name is Christine Perez. I am the Director of Programs at the National Hispanic Council on Aging, or NHCOA for short. And practically, our mission is to improve the lives of Hispanic older adults, their families, and caregivers. So thank you for joining us today, and I'm going to pass it to Cheryl.
Thank you, Christine. My name is Cheryl Wayland. I'm the Senior Director of Special Initiatives and Partnerships at SAGE, where we serve LGBTQ plus elders, and just really excited to be a part of this panel today. And I'll pass it on to Mansha.
Hey everyone, my name is Mansha Mirza, and I'm a South Asian woman with dark black hair, with gray streaks, tied up in a ponytail today, wearing white gold earrings and a dull gold jacket. And the virtual background behind me that you see is the East Campus of the University of Illinois, Chicago, where I'm a professor, and I am representing ASIAAN today, which is Aging Services Inclusive of Asian American Networks, and I go by she, her pronouns. And I'm going to pass it to one of my colleagues here, Sumitra Murthy.
Hi everyone, I'm Sumitra Murthy, and I co-direct ASIAAN along with Dr. Mansha Mirza. And just to let you all know, I am also a South Asian woman with black and gray hair tied back in a pony. I wear spectacles and I'm wearing a green blouse. And my background is the Chicago skyline and with the campus, with the UIC campus. Hello, everyone. Nice to meet you all.
Great, thank you, everyone. And we have Maya from UIC and Angela from NCBA also, if people.
Oh, I apologize. I didn't pass it. Yeah.
I know they're listening in. Great, thank you, everyone. So for today's webinar, we're doing it panel style. We're going to start with the first round focused on accessing and navigating support for caregivers, and then we'll move on to a second round around sustaining well-being and building support systems for caregivers. So we'll start with a question directed at NCBA today. Caregivers are often balancing health, financial, and social needs at once. What are the most important types of support they should know about, and what's a practical step for getting connected to these?
Thank you, Dana, for the question. One of the most important things I think caregivers should know about are the resources in their cities and communities. And what I mean by that is your local library is an excellent place to get caregiver supports. Drop in and connect with a librarian. They offer tons of information about support groups. If you're in need of Alzheimer's information, tax preparation, legal services, estate planning, they even have a roster of handy people who can help you with home tasks, delivery services, and so forth. In my community, the sheriff's department is an excellent place to connect with. They provide a personalized tracking wristband program for individuals with Alzheimer's, autism, or Down syndrome. They also do have a wonderful service that speaks to frauds and scams. So do check out your local sheriff's office. And then also, we know about churches and faith-based organizations, but I want to just note that sometimes they're a little bit overwhelmed, so we might want to look at our other resources. And I'd like to leave the question by encouraging everyone to please connect with their local Red Cross. Beyond our day-to-day caregiving activities, I'm a caregiver. Life happens. We're in the midst of storms. And many of our communities don't have backup generators. And so the Red Cross has a series that will teach a caregiver how to become Red Cross ready before, during, and after a storm. And they will leave you with the tools that you need to secure your home and yourself and your loved one. Thank you for the question.
Thank you very much. And each of these technical assistance resource centers has rich websites with a lot of information touching on some of the things that Angie just mentioned. We also have an overall resource library that everyone can check out, where we host resources from all 5 technical assistance resource centers. So just putting in a plug for that as well on the topic of being able to know what's out there and accessing it. Now moving on to Christine from NICOA. When caregivers are coordinating across multiple providers and systems, what strategies help them communicate effectively, ask the right questions, and stay organized?
Thank you, Dina. That's a great question. I want to start mentioning that caregivers can stay more organized when they have one main contact. That's the person who helps connect all the pieces of care. For example, I want to share an example today of Sonia. She cares for her mother, Agatha, an older adult with several health conditions like diabetes and heart disease, and in which, of course, she sees different doctors for. So in this case, the primary doctor becomes the main coordinator. So the daughter communicates mostly with that doctor and the doctor's staff instead of trying to manage every specialist on her own. And also the primary care office helps by keeping and updating a full list of everything related to Sonia's mom care. So for example, they can provide with the daughter with a clear list of specialists that her mother is seeing, such as cardiologists, pulmonologists, along their names, the phone numbers, and also the address. And I want to also highlight that another important support is language access. If Agatha or her daughter Sonia needs help in understanding like medical instruction, having that option of requesting interpreting services makes it a way more easier for them to ensure that they can fully understand the doctor's advice, particularly when it comes to medication changes, treatment plans, or follow-up care. And again, we want to mention that medical terms can be hard to understand, especially when they are explained in a language that is not the person's first language. And having interpreters can really make communication easier and help caregivers like feel more at ease. And just to close out, I know continuing with the caregiver with Sonia, well, to stay organized, the caregiver can keep like her mom's health information in one place. For example, a notebook that she can bring to her right in every appointment, and also writing down the questions before the visits, such as has anything changed with my mom's diabetes or other medications? Because life happens and a lot of things come up, and the caregiver might forget. So copying it or writing it in a notebook helps. And just keeping track of her mom's medication, among many others. And also want to highlight that for many Hispanic families, this approach works very well because caregiving is often family-centered. So when possible, other family members may also ask help, like, okay, where is my mom's appointments? Like saving updates in a shared phone or reminding each other about the follow-ups. So this kind of system really helps to reduce confusion and even make it easier for caregivers like Sonia to feel more confident, informed, relieved, and supported as she cares for her mother.
Thank you so much, Christine. Some of the things that you touched on, there's been a lot of development in health technology to support caregivers or support clients themselves and older adults themselves with managing, for example, medications, some of the language accessibility issues. I know I'm going off script a little here, but I wanted to add a bit to the question. What are some of the health technology and things like AI that you have seen address these challenges that you were just mentioning?
Yes, absolutely. So there's a lot of applications in mobiles that caregivers might look out on their phones, but again, there is the real side is that many caregivers are very busy and sometimes they don't have time or they're not tech savvy to just learn how to access their phones or access the app. Sometimes they need to care for their mom, and having an application might be challenging for them. But there is help out there. You can also reach out to an organization like NCOA. By the way, we offer technology classes, which are virtual and free for everyone. And in that way, we are teaching caregivers and overall population, including older adults, how to use their computers, their smartphones. And we actually have a section about AI, artificial intelligence, and how they can help them. And we encourage all of you to reach out to us. I can give you the number of the resource center. That is 202-658-8664.
There's a question in the chat. Can you share details and links to the free technology classes?
Yes, I will type it.
Yeah, I'll type it in the chat.
Thank you.
Great. There's also the Older Adults Technology Services, OATS, which does offer a lot of free classes as well. So please do check that out if you are not aware of them. And given, just staying on this topic a little bit longer, given that all of you do work with older adults and caregivers and hear about their experiences, have you heard any concerns around ethics, privacy with the use of some of these tools? What are some of the conversations that are being had right now? And how do we navigate this as the technology takes on a speed that's faster than what we might be keeping up with? Any reflections on that from anyone on the panel? It's a tough question, I know. Cheryl?
I'll give it a go.
Yeah.
I do think AI is definitely it's coming into our worlds, whether we like it or not. And, I think it's really important that we have conversations with caregivers as well as the person receiving care about what it means, to interact with AI and what are the privacy, what privacy guards should they be looking at, and really make sure that they understand what it means when they're giving information potentially, to a program that's an AI program. So I think there's some basic safety things that we should be lifting up as organizations working with older adults and caregivers. And that may be a perfect next
It
project
is.
for this team to look at. So thanks for that question.
Great.
Just to add to that, can I just add to that?
Of course, please.
I think AARP has some resources for improving AI literacy for older adults, and I can put that link in the chat. And there's also like a series of really neat YouTube videos targeted at older adults about, just introducing AI and how to tell AI apart from reality, as well as, making sure you don't share like sensitive health information with AI tools and other like tips and strategies. So I can post that link in the chat as well.
That would be great. Thank you so much. And I'll also put in Senior Planet from OATS and AARP as well for additional resources too. Great. Thank you, everyone. Our next question is around caregivers in rural and tribal communities. So we're coming to you, Billy. Caregivers in rural and tribal communities may face additional barriers to accessing services. What helps these caregivers navigate these challenges, and what community-based strengths are often overlooked?
Okay, well, thank you for that question. First of all, I would like to speak a little bit about NICOA, the National Indian Council on Aging. Our mission is to advocate for improved comprehensive health, social services, and the economic well-being for American Indians and Alaska Natives. And at this point today, we have, there are 575 federally recognized tribes across the nation. And so within these tribes, tribal communities, we work very aggressively and continuously with tribal leaders, with our programs that are mainly out of the Older Americans Act, in particular Title VI, which is directed for Native Americans, and that includes our congregate meals and transportation needs, things of that nature. And I do we do always want to help caregivers navigate through their daily lives, which I know personally I am experiencing that, as some of you may be doing also within my family. And so I hear of transportation needs. There are in most of the tribal communities, we deal with Native Americans we're covered under the Indian Health Service, which is a federal government agency for our health care. And within the tribes, they also have what they are called community health representatives, which can also provide the transportation to and from the medical appointments, wound care facilities, whatever that medical appointment may be needed. In particular, I want to just mention a family member is a full-time caregiver for his wife, and I think transportation is a very big issue for them, a big challenge, especially now that what society is facing are inflation issues. And so NICOA is working strongly with the different tribes about trying to alleviate and some of these issues, of course, challenges and barriers within the rural tribal communities. Some of our rural tribal communities are so in the rural areas where even having internet services, things of that nature come into play. It's a barrier there in itself. Speaking of AI, a lot of our rural communities may not even have the access to service for even your cell phones, your laptops, things of that nature. So I think technology is also a big barrier in our communities, and we are striving to work with the tribal communities to get certain broadband capacities out there across the nations. And I think the education of caregivers, and in particular, I have in mind a family member that it seemed like his caregiving duties just appeared all of a sudden, very, very, very stressful for him at this time. Not knowing a lot of even the medical terminology, not knowing the procedures. So I think educating the caregivers and finding that support for them as well, because I feel like you cannot take care of somebody else if you aren't taking care of yourself. So we need a lot of support for emotional support. Even physical support. We need to have training and education for these caregivers. And there are opportunities within our tribal communities, a lot of it, within the tribes, within the Native American tradition and culture, family and elders they are held in such high esteem. Our traditions are based on our family values, taking care of our families, tribal leaders and elders. They are the center point of our tribal communities. So we are doing our best at NICOA to ensure that our elders across the nation are aging in place as much as possible. And there are many barriers on a day-to-day basis, but I think the two things, we do have Indian Health Service, like I just mentioned, and that's under federal government treaties for Native Americans that we are provided medical needs. And we also have something called, I know in Oklahoma, and I'm from Oklahoma originally, is we have the Oklahoma Indian Legal Services. So a lot of our caregivers can turn to that service as well for legal issues, maybe creating the the patient's will or whatever legal documents they need, powers of attorney, things like that. So we offer a lot, we're finding a lot of resources, and that's in addition to the state government resources, local resources. But again, just like the person I'm talking about, the new caregiver that is undergoing a lot of stress and uneducated about caregiving, learning every day something new. It's the transportation. Being in a rural area, his wife is on dialysis 4 times a week. Getting to the dialysis center is 45 miles away. Getting to the heart doctor is in Tulsa, Oklahoma, which is even farther. Getting to diabetes doctor that's 3 different providers in 3 different towns that they need to travel to and from almost on a daily basis. So we need to really keep advocating for these programs such as the CHR and the Title VI and the it's just a very important mission that we are all on here today. And I'm so glad to be part of this panel. So that's, there we have the resources, just as the other panelists have mentioned, the libraries. And I appreciate knowing about the Red Cross that I can pass on. So I really do appreciate this opportunity. And thank you. If there are any questions.
Thank you so much, Billy. And we do have a comment in the chat that says local offices for aging have NY Connects for caregiver resources in their communities. It's a great resource as well.
Right.
Billy mentioned a new caregiver that suddenly had to face a lot of new responsibilities. So that leads us into the next question around when caregivers don't know where to start. What trusted community entry points, such as local organizations, faith-based groups, or community leaders, can help them to connect to the appropriate supports? And I'll send that over to UIC.
Thank you, Dana. So when caregivers are starting with a completely blank slate, my recommendation would be to first connect with their State Department on Aging, either by phone or visit their website. And typically the State Department of Aging will have a listing of area agencies on aging that are regional service providers. And depending on the state, the area agencies sometimes contract out with community-based organizations. So your regional AAA might be able to connect you with a local community-based organization that can help you figure out resources that you might be looking for to support caregiving of the older person. The other aspect of your question was, I think my recommendation would be different based on the caregiving dynamic. So in some cases, the caregiver and the care recipient are in the same age group, right? So it's either a partner or a spousal caregiver. And in that situation, both the caregiver and care recipient are part of similar networks, right? So, for instance, they're both attending senior support groups provided by their local faith-based organizations. So I would say start with the networks that you're already a part of in that situation. But then there are caregiver dynamics where the care provider is from a younger generation, either a child-in-law, or a grandchild. And in those situations, what we've noticed in our work is that although the senior that they are supporting might be connected already with a community-based organization or with a senior support group at a faith-based organization, the younger generation caregivers are not connected with those agencies and sometimes are not even aware of what resources their care recipient is already connected with. So I would say, start with a conversation first at home, right? And then take it from there. And the third piece that I would like to add in response to this question is that something that we have encountered with caregivers is that time is a very precious commodity. A lot of caregivers in the younger generation are sandwich caregivers who are caring for an older person and younger people at the same time while also holding down, a day job and sometimes multiple day jobs. And so this recommendation is specifically for senior service organizations to better be able to support caregivers, provide services and consulting after hours. we've had the most success in reaching caregivers when we offer our services either in the late evening hours or on weekends. So I hope that answers the question, Dina.
Great, thank you so much. And it really speaks to the point of meeting people where they're at, whether it's about the other responsibilities that they have or just geographically where they're at. I think we're all touching on some of those points. Great, thank you all. Are there any questions from the audience from this first round around the different resources that exist and how to use it? Questions or comments, resources you'd like to share in this space for everyone to know about? Please feel free to, I think you can raise your hands if you'd like to say anything. Yeah, okay. Great, and now we're going to get to how caregivers can identify services and providers that are responsive to an older adult's individual needs, preferences, and lived experience. So really around this meeting people where they're at. And for that, I'm going to ask Cheryl to speak to it.
Thank you so much, Dana. I think as you've heard, from this first round of questions, we each bring a unique perspective to this work based on the cultures that we represent and the communities that we represent. And I think when we are thinking about identifying services and providers, it's so important to start with your local community. Who are the organizations, social groups, faith-based, communities? Who are those communities that are closest to the work, that are closest to your communities? And starting with those networks can be really, really critical. At SAGE, we are a national organization, but we also have 120 plus local community organizations across the country that we engage with on a daily basis through a program called SAGE Collab. We oftentimes will refer people back to their local community, to find the services that are going to best meet the need of the caregiver and the person that they're caring for. So we just really, encourage you to start at that community level. As was mentioned, the other groups that are really important are going to be your area agencies on aging. They are oftentimes the entryway into these services. And, we have a very close working relationship with area agencies on aging across the country. So we never want to forget, our area agencies on aging, and as well as the 211 network system. They can also be really important when reaching out for those services. And I'd also say that, we've developed a number of resources and toolkits at SAGE that can help provide guidance for caregivers as well as their loved one when they're seeking services. And I'm sure that our other fellow resource centers here on the webinar today also have a number of toolkits and resources that they would offer up to the communities that they serve. And just lastly, I'll mention that many of us come from multiple minority statuses. And so it's important that we think about intersectionality and how at any given time there may be a specific need that's more important based on a certain perspective that we're holding. And so it's really important that we think about all the things that make us who we are when we're talking about caregiving and supports and services. So thank you for that question.
Thank you so much, Cheryl. And that's something that being part of this group has been really enriching around, because the different technical assistance resource centers all have different perspectives and communities they're serving and thinking about, but coming together, you really apply that intersectional lens and see how those different needs can be met through more synergistic strategies. So thank you for pointing that out. And we do have a question in the chat around and the importance of thinking about non-traditional caregivers. I think Mancha was mentioning children and potentially grandchildren. The question states, what are your thoughts about maybe a neighbor or a friend that is a caregiver? And any panelist can, yeah, Cheryl, you can start, and then Angie.
Caregivers come from all different places in our lives, and not all of us have children. Not all of us have close family ties. And so it's really important to think about, neighbor helping neighbor, friend helping friend. Many of us create our own family structures. And so, looking beyond that traditional caregiver is really important. There's a whole growing network of solo agers. And I think the solo aging movement is something that we can all look toward to see, how are they identifying caregivers in their lives and what does that look like?
Great, thank you, Angie. Oh, you're muted, I think.
I agree. Thank you, Dana. I agree with everything Cheryl said. I will say, as a caregiver, my neighbors have been wonderful, but I also have to bear in mind the wants, the needs of my loved one. Will my loved one trust that neighbor? I love my neighbors, but my loved one, not so much. So it's one where I have to be very thoughtful who I look towards, and I think all caregivers, who you look towards to bring into your space, to your home.
Great, thank you. And I think that's, yeah, Manchaka.
Yeah, real quick, if you're a neighbor or a friend who is the primary caregiver, I think the day-to-day caregiving is going to look very similar to any other caregiver. However, some of the larger issues can get complicated, like emergency medical decisions, financial planning, legal planning. So in those situations, if that's the role you're going to be in, I think it might be important to work with like the next of kin, like the closest blood relative if someone is around, or another family member who has more legal authority to maybe transfer, right, some of that authority to you if you're going to be in that role. So I just want to put it out there that there might be legal complications for bigger caregiving issues.
Yeah, that's an important issue to flag. And in some of what Angie was saying, I was hearing this distinction between the non-traditional caregiver and potentially the neighbor or friend who's supporting a potentially more traditional caregiver and being their support network and giving them a bit of respite as well. So that leads us into our next round, which is around sustaining the well-being and building support systems for caregivers themselves. And I'm going to throw it back to you, Cheryl, with what are practical ways caregivers can support an older adult's dignity, independence, and emotional well-being over time, especially when making decisions about care settings, which is something Mancha was sort of alluding to.
Right. That is such an important topic as well. I like to say that it's never too early to plan, but it can be too late. And many of us are already planning to be a caregiver for a loved one, for a friend. And if we find ourselves in that situation, similar to what Angie said, it's so important that we think about our loved ones' wants and needs and wishes, and that we should always be centering, those wants and needs and wishes. Um, at Sage, we've created a number of resources. Again, we have an advanced care planning toolkit, and that is designed specifically to help the person that may be receiving care as well as their loved one to think about those things that they need to put in place. Advanced care planning is so important, and that's really when the opportunity is there to name what's important to you, to make sure that you have your durable powers of attorney in place, your advanced care planning tools. And without those, especially if you're not a blood relative or the next of kin, then you can run into legal conflict with the wishes of your loved one. So it's so important that caregivers think about, what needs to be in place if we find ourselves, really providing that day-to-day care and support for a loved one. So those are some of the things that I would lift up right now. And, just really making sure that, we plan early and that you have those conversations on a regular basis. It's not a one-time conversation. It should be ongoing. And I do see that there's a request for the toolkit, and I'll place that in the chat. And if one of the hosts can share that out, that'd be great. Thank you.
Thank you so much, Cheryl. And we will also be sharing the resources after the webinar for anybody who registered. You'll get a list of all the resources that have been touched on, but we'll put it in the chat too. Now, caregivers also need support, especially when they're having these difficult conversations and all these, the workload of it as well. So what are effective ways they can maintain their own health and access relief when needed? And I'm going to put this to Christine from NICOA.
Thank you, Dana. So as you mentioned, caregivers do need support, and based in our experience, uh, in the field, there are simple and practical steps that we want to share with all of you today, and that can really make a big difference in staying healthy. And for example, our first one would be to seek community support. Organizations like all of us that are here today, including the National Hispanic Council on Aging, well, of course, on our side, we provide caregiving trainings and also share resources in Spanish, English, and even Portuguese, where caregivers can share their experiences, receive guidance, among many others. And for instance, we offer a free caregiving training, both virtual and in person. We do it in Spanish. And also it's specifically designed for Latino family caregivers. So these trainings provide self-care tools that can help improve the physical and mental well-being of the caregivers, not only in their caregiving role, but also in their personal lives. And for more information, again, you can contact us at NCOA.org or our resource center. You can call us at 202-658-8664. And I also want to highlight that people can actually, as I believe Angie mentioned earlier, like the churches, some activities that they have, and also senior centers or community spaces around you. Again, small steps towards support can really make a big difference in a caregiver's health. And also, it's important to make time for doing something that you enjoy, like a hobby, listen to music, take a short walk, or rest for a few minutes each day. And again, don't be afraid to ask for a family member, a neighbor, or a friend if they can stay with your loved one for at least 5 or 30 minutes or so. So you can take a break because every small step counts. And lastly, reach out to your doctor or the clinic if you're feeling stressed, tired, or overwhelmed when providing care. They can connect you with services such as home health aides, counseling, or even transportation. And I want to close that to remember that you're not alone and asking for help is not a weakness. It is necessary and your health matters too. Thank you.
Thank you so much, Christine. We know that social isolation and loneliness are growing problems globally, especially among older adults and also among caregivers. It can be a lonely endeavor sometimes, and as Christine was mentioning, you're not alone. So how do we make sure that we can access support systems, and what are effective ways caregivers can stay connected to community and peer support? And where does respite care fit in? And I'm going to put this to UIC.
You're absolutely right, Dana. We constantly hear from caregivers about how they've lost some of their social ties and relationships because of how overwhelmed they are with caregiving. But this is also a challenge that is really difficult to address because being less isolated and connecting with others means finding the time to do that. And like I said earlier, time is at a premium for a lot of caregivers. So something that I would recommend is maybe starting with virtual online support groups, right? That you join at your convenience. It could be once a week. Maybe you check resources that are posted to that group on a Friday night at 10:30 when everybody's in bed and you have a moment to yourself. Maybe that's the time you reach out and connect with people. And there are some examples that I could give here. So, for instance, in the South Asian community, there's a virtual network of caregivers called Desi Daughters, and they provide a platform for South Asian caregivers who are supporting older adults. And it's an international network, so it caters to both diaspora South Asian populations here in the United States, but also people living overseas in countries of origin. So it's a great resource for asking culturally specific questions and getting culturally relevant support and connecting with others. But if connecting with a large network like that doesn't feel comfortable, people could maybe start small. So look around you. Maybe in your neighborhood, there might be other people who are also caregiving for older persons, and maybe create your own chat group. Maybe have a shared calendar so that if someone needs caregiving backup in a pinch, another member of the group can pitch in, and then whoever gets that support can return the favor the following month. So that would be another example. And then I also wanted to share the Caregiver Action Network. It's a national nonprofit that provides a variety of online resources as well as networking events that are based on specific caregiving needs. So they have events by health conditions. So if you're supporting someone with cancer or dementia, they have specific resources for that. It's low commitment, right? So you can sign up, get notifications, attend what events make sense for you, and then if something doesn't work out, it's okay to skip. They also have a caregiver help desk. So if someone is feeling really, really isolated and needs, quick support, someone to talk to, just vent, they can always call their help desk as well. And I can post their link in the chat. And then you asked about respite. For caregivers, I think it's important to reach out again to their area agencies on aging and ask about formal respite care services. They can ask if the person they're caring for would qualify for homemaker services, right? Where someone comes over, is a paid caregiver that helps with chores and errands that can then relieve the informal caregiver. The other option would also be to ask about adult daycare programs if the person they're caring for is physically able to attend one. Because during the time that they're out, which is typically half a day, like 4 to 5 hours, the caregiver at home can get some respite, focus on themselves, like Christine was saying, right? Practice self-care. So those are my recommendations.
Great.
Uh, can I just add one more thing to that? I think Mansha has provided a lot of great points. The only one that I wanted to add also is there are some community health service learning programs as well, uh, mm, especially like college students could go and make weekly visits to the older people, and then that would give the caregiver some respite. And one of the examples is Lori's Hands. I can put that in chat, but that's one of the organizations that actually helps student volunteers connect with older members living in the community with chronic illnesses, especially, and that gives some respite to the caregiver. So there are those service learning programs as well, which are community health service learning programs.
Great. Thank you so much for sharing that. And yes, it would be great if you shared it in the chat. There are also great models for different locales to sort of learn from and implement as well. On this topic, we've obviously heard a lot about how important family and community networks are in the success of caregiving. So, Billy, I'm going to come back to you with what strengths do these community networks bring and how can they be sustained over time?
Oh, okay, thank you for that question. I do want to point out that within NICOA and on our website, we do have a section that is entitled Family Caregiving Needs in Diverse Older Communities. And so we base that program off of caring for those who care. And we have that toolkit available on our website that social providers, healthcare providers, that they and the caregiver themselves can utilize that toolkit. And we also have a NICOA compass, which helps individuals and tribal leaders understand what continuum of the care is and how it benefits the community and promotes independence, health, and quality of life for elders and people with disabilities. Within our tribal communities, like I mentioned, there's 575 tribal communities in the United States. And so I always like to focus on how can we better look at what providers can help us with our caregivers and the patient and the services. And so I believe it's necessary to be aware of their roots. The providers could be native, non-native. They need to be aware of the roots of Native American traditional societies in the social, historical, cultural, economic, and environmental issues. That strengthens tribal and community-based organizations to increase the capacity of programming. We also look at shared dedication rather than the reinventing the wheel. So we look at how we can strengthen and improve a lot of our programs that way. We also are collaborating, as I mentioned earlier, with the Indian Health Service, which again has agencies across the United States, and we collaborate through them with the community health representatives who are a vital need, a vital strength for our elders and the caregivers themselves. A lot of the issues that all of you panelists are bringing up is just so much needed, so many areas that can be strengthened and developed throughout our advocacy. And one thing, with the CHR program, it helps to overcome the geographic isolation. They assist tribal communities in the funding for local resources, and we develop culturally and linguistically competent in-office material so that we can disseminate, which would also enhance the education of the caregivers. And I think consulting with tribal leaders and the elders and the local institutions of these communities about disseminating these printed materials would really develop and increase capacity programming. And we want to reduce the stigma, provide disease information, and caregiver training information. And again, as I mentioned earlier, our tribal leaders and our elders are the center point of our tribal communities. It's very important in order to have these tribal community programs within our nation. We really need to have that support from our tribal leaders, our tribal governments, the ones that are the policy makers and in power. And so that's part of our advocacy. But I believe these are really needed in strengthening our community based services and helping our caregivers and their families and the patients. So hopefully we can just stay on top of all of these programs that we are doing our best to provide for our elders. Thank you.
Great, thank you so much. I think your point really makes clear that there's all these different nodes across community networks, and that cultural humility and responsiveness is necessary at every node, from the caregivers themselves to providers to policymakers and beyond. So thank you for highlighting that very clearly. And for our last question, we're going back to thinking about future planning. Cheryl mentioned advanced care planning tools. Caregivers should also keep in mind their long-term well-being, not just for their the older adult and loved one they're caring for, but for themselves as well. So what should they keep in mind when planning for long-term health, financial, and quality of life considerations? And that's for Angie.
Thank you, Dana, for the question. The short answer, be flexible. Even the best made plans are subject to change. I found the longer I care for my loved one, they've changed and I've changed. So it's important just to be flexible. But I want to add something to that. As we make plans, share them with someone. It's important that somebody know your plans. Caregivers, I don't have the stats, but many caregivers pass on before the person they are caring for. And so if your plans aren't known, then your loved one is without care. So it's really important to document those plans as best you can, maybe with legal representation. Also, maybe sharing them with the court systems. Really, really important wherever you are in your care plan to share and document. And just remember to be flexible, because what happens on day one is really different down the road.
Thank you so much. I think we can all learn a lot from that. Thank you. So those were the questions we had for the panel. Are there any audience questions or comments that you'd like to share in the last few minutes?
I would like to add something to what Angie just touched on real briefly. The new caregiver that I'm speaking of in the rural tribal community, I advise them to also, as Angie says, have a plan in place. To me, we're in central Oklahoma, where we're known to be a tornado alley, if you will. So we could have since the caregiver is administering dialysis at home on a regular basis, 3 to 4 to 5 times a week. I said, you might want to talk to the fire department. You might want to let the law enforcement know. You might want to let the small rural hospital staff know what happens if the electricity goes out. What happens at 2 a.m. in the morning if your machine malfunctions or something, you have a medical emergency. How well are they equipped to administer help with dialysis? So I really appreciate Angie bringing those resources up. Thank you.
Welcome.
Thank you. Yeah, everyone has shared such rich resources. And as I mentioned earlier, we will be sharing with everyone who has joined today, as well as anyone who registered. And we know some people could not make the time, but they were interested in seeing the recording and receiving the resources. So we will be sharing those. Is there anything else from the panelists that you'd like to share? Some final words of wisdom?
One,
Yeah, please.
caregiving is rewarding, definitely tough. Have fun. If you can find just a bit of fun in your caregiving journey, it's just well worth it. And from a personal lens, I have connected with the recreation center in my neighborhood. They do focus on caregivers and bring fun to the caregiver. So I can't believe I'm saying have fun, but do try to have some self enjoyment in your journey, and do prioritize rest, relaxation, and you might have to be creative with respite care, because respite care isn't a one size fit all. So you might have to get creative, but do prioritize respite care. Thank you.
Thank you so much, Angie. I think that's such an important thing to keep a hold of. And we know that creative aging, for example, is so important for healthy aging, getting older adults to engage with the arts and to play. And I think that much is just as important for the caregiving relationship as well, and for caregivers themselves. So it's a really important reminder for everyone. And a great note to wrap up on. Any final comments from anyone? Great. Yes, we have a form in the chat from Isaac. This is just a review of the webinar. Please fill it out and let us know how it was. There's also space for some comments and questions, so please do fill that in if you would like any follow-ups. Thank you to all the panelists. We really appreciated having you here. I've learned a lot. Thank you for sharing all those resources that you have and for the work that you do more generally too. Please do check out their websites. There's really rich resources all over there. And we shared the Collaboratives resource library as well that has all of them put together. So please do take advantage of those resources available to everyone. Thank you, everyone. And thank you to those who joined us today. We really appreciate it. Bye, everyone.